we're also wondering, well, what do we do now as this crisis is unfolding in order to best support us and to shield us, if you will, as we figure this out and hopefully get to the other side. And so in that work, he was able to partner with opportunities such as the Baltimore Health Department, as well as with more regional entities such as the Rockefeller Foundation and other individuals who were really trying to figure out, can't make the vaccine, but there is something that I can do. And I know that each and every one of you in this room, we're in that time and in that similar place where you might not actually go and create the vaccine, but I know that each and every person in this room did something in their community and in their family. And so we're really in a space with not only like-minded individuals, but really like-spirited individuals who are about continuing the work forward, especially when the challenge gets most pressing and most critical. From doing the work, what evolved was the Baltimore Health Corps. I know a few of you in the room were community health workers within the Baltimore Health Corps. So thank you for your service and thank you for continuing to partner with us and coming back into this opportunity. And then from the Baltimore Health Corps, an initiative that focused on individuals who are particularly experiencing job loss and how to support up the COVID-19 response with the Baltimore Health Department. From there, we ventured into work with Be More Vaxxed, which was also an opportunity to partner with community partners and to really educate those of us and our community members on what the vaccine was, what it offered, and providing all the information that was available at that time so that no matter what decision a person made, it was an informed decision that was coming from people who look like us, who understand our worries, our needs, and our resources, and we're able to share that information. From Be More Vaxxed, 75% of residents in Baltimore City are vaccinated, which was a big win from that campaign and that initiative in the last 2 years. And then from the work, so we're going from Baltimore Health Corps, Be More Vaxxed, and now we're here at Community Health Pathways. So last year, we partnered with Public Health AmeriCorps, some folks that you'll meet here today from Public Health AmeriCorps, with an opportunity to really continue the work of community messengers. And what does it look like to involve individuals in the community in health work opportunities, aside from your run-of-the-mill healthcare careers? And so really what the pandemic offered was an opportunity to explore emerging careers in public health and what it really means to involve and work alongside community members and to be able to offer an opportunity that could really support people in public health career journeys. So in some of our work with Public Health AmeriCorps, we also partner with some community partners. One near and dear community partner and initiative, the Healing City Initiative, and Councilman Zeke Cohen, and really learning about the work that was already being done in Baltimore City to both not only educate residents, but to empower residents and how they become community messengers for the work that's carrying out when it comes to reducing overdose deaths, when it comes to ensuring that there is resources and solutions around food insecurity. When we're talking about, well, what does it look like to actually solve the epidemic around violence? And what does it really mean to work in violence prevention? We started to connect with community partners who were already doing this work so that we could join forces and align with them and then apply for this opportunity with Public Health AmeriCorps, in which we were able to take that at a grander level and offer the opportunity in which you guys are part of this program today. I really think of Baltimore Corps as not just one thing, and it's going to be difficult. You'll see in this journey with us, and people are asking you, so what do you do? How does it work? Who you're a part of? You're an AmeriCorps member. You're also part of the Baltimore Corps Network. You are also all the things that you embody in your personal space and in your communities. You're not just one thing. And Baltimore Corps isn't just one thing. is going to continue to occupy many spaces so long as we are working alongside community, bridging the gap between community and our systems, such as our governments, our community organizations, our funding spaces and philanthropic spaces. We're going to continue to take up space. And really, this opportunity is for each and every one of us to continue to take up space in the work of health equity and what it really looks like to put Baltimore City in a more healthy place. So the folks that you are going to hear from today are going to talk to you about their story and how they are supporting Baltimore City, a city that they love, a city that they live in, a city that they are a part of, and be a more healthy place. And then to connect it back, was it last week or 2 weeks ago? You know, it's kind of going fast now. But to connect it back to 2 weeks ago, when you guys were talking about how you already have taken up space and you're taking up even more space for Baltimore City to be a more healthy place, I want you to continue to connect your stories back. Because remember, as it gets harder, and it is going to get harder in this profession that you are venturing down, it's also very important that you remember your why and that you are surrounded and also networked to many change makers across the city who are doing similar things as you and really pushing this initiative of health equity forward in our city. So with that, I would like to introduce Councilman Zeke Cohen of the Healing City Initiative and District.
Thank you so much to Tamara, to Sarah, to the entire Baltimore Core team. I actually live right around here, so I decided to just roll out of bed and walk to here. Bad move. I'm a sweaty mess, and we'll try not to sweat on your podium. But let me just start with a few quick acknowledgments. First off, thank you to all of our folks with AmeriCorps, with Governor Wes Moore's office. I want to give a huge thank you and acknowledgement to one of our partners in local government, Deputy Mayor Jaraza, who is right over there. And I'll just say this, as Tamara was talking about the pandemic and COVID-19, there is no one in this city who did more to reduce transmission and death than Letitia Jaraza. She was at the time the health commissioner for Baltimore City, and we are incredibly proud of the work that Baltimore Core did, the fellows. But I gotta tell you, when you look at Baltimore and how we did in terms of preventing death and transmission compared to similar cities, Baltimore actually did really, really well. And I think a lot of it had to do with the amazing messaging and some of the really tough decisions that our health commissioner made. So again, thank you for your work. I want to thank also my friends from Healing City who are here in the house. And then I want to talk to you a little bit about my issue and what got me into this work with Baltimore Core, which is the issue of trauma that we know is so pervasive in our city. And for me, this started a few years back after a school shooting that took place in West Baltimore. Some of you will remember it was Frederick Douglass High School, and a gentleman walked into the school with a gun, shot one of the school staff. This was during school hours. It was incredibly traumatizing for the children and the teachers and everyone that was there. And after it happened, there was this sense of just what comes next. Folks really felt abandoned. And so we held a hearing in the city's Education and Youth Committee. And the name of the hearing was Youth Voices, Youth Violence. Because we wanted to hear directly from our young people about what they felt we could do to mitigate their exposure to gun violence. And I'll never forget hearing from 3 of the students that were there when the shooting took place, Gianna, Damana, and Brianna. They were juniors at the time. And the thing that they said to us is, listen, you all, our city council, spend far too much time thinking about how to police us when you should be thinking about how to prevent this type of tragedy from occurring in the first place. And they named every single ACE, what are called adverse childhood experiences, in the book. They talked about what it's like to grow up housing insecure, food unstable, to deal with a family member that's struggling from substance misuse disorder, to see violence in community. They talked about all these things and said, that's what we want you to focus on. Not whether our school police should have guns, not whether we can harden the target of our school, but this issue of trauma that so many Baltimore City children grow up experiencing. That's what you need to work on. And me, I'm a former teacher, and when you hear young people speak with that level of clarity and precision, it really behooves you to listen. And so I went up after the hearing and I said, look, I think you're spot on about this issue around childhood trauma. That is what we got to work on. But instead of me going back and writing a bill, why don't we work on something together? Because I fundamentally believe that your story, your experience, your lived experience will help to produce better legislation than that which I could write. And they were cool about it. And they said, sure. And so we spent about a year doing a listening tour across Baltimore, in libraries, in laundromats, in rec centers, in classrooms, really trying to understand this idea of trauma, how it impacts the brain, the body, what it does to people, and how we as a city could effectively mitigate it through the law. Because at the end of the day, that is what I do. I'm a legislator and I write laws. And about a year later, we came back to Frederick Douglass High School, which is where that shooting had taken place. We had a big community healing day. We had young people, we had elders, we had all sorts of groups. Baltimore Core was there. All these different groups got together with this big community healing day. And then the young people, Gianna, Damani, and Brianna, spoke about what it was like not just to have had this awful, traumatic experience, but to then take their power back and actually do something about it and help write a bill and lobby for it and advocate for it. And then the mayor, who was Jack Young at the time, signed the Elijah Cummings Healing City Act right there at their high school. And that made Baltimore the first city in America to have legislated trauma-informed care into law. And with our partners in the health department, we have been working really hard for the last couple of years to implement that legislation. But not just within government, across our city. Because we know that if we are going to truly address this issue of trauma, it can't just be Baltimore city government doing it. Because you all know, you live here, if something just happens in government, but it's not felt in community, it doesn't matter. If people can't feel it and touch it and experience it, and that is why Healing City, this movement, has been so important. It's organizations, it's groups working together across lines of difference, across race and gender and ideology, folks from universities, hospitals, nonprofits, teachers, young people, everyone working together to try to address this issue. And one of the things our bill did is it called for us to train our city agencies in trauma-informed care. And so we actually started with our library system. We spent about a year working with them to help our librarians and our security guards and our administrative folks understand this issue and to be able to help when folks go into a library to identify it and then to be able to help someone deal with it. So teaching restorative practices and mindfulness and all these evidence-based approaches. And what was powerful is that after we did this training, what the head librarian, Heidi Daniel, said was, look, now it's not good enough to just train us. Let's look at our actual policies and procedures and make sure they are trauma-informed. And what she came away with is she said, you know, Zeke, we've got this zero tolerance policy, and it just doesn't make sense, right? So anyone who walks into the library who's either drunk or high, the procedure is you write them up and you kick them out. And look, we can all understand you don't want someone acting erratic in a library, but we know in the year 2023 that addiction is a disease. And that just to further stigmatize it and kick people out of a public space is no way to treat it. And it's certainly not trauma-informed. And so Heidi said, we're going to get rid of that policy, and instead we are going to bring peer navigators into our library branches, starting in Penn North in West Baltimore, which has been the epicenter of the opioid crisis in our city. And so we started with one navigator, and this person was someone who had lived experience, who had struggled with addiction, but who became trained. She went through a whole training, and now she helps folks to be able to get access to treatment, Narcan, housing. One woman came in and needed diapers for her child, helped her get diapers, right? It is taking folks' lived experience, putting it to work, leveraging it for better. And that is what has come out. We were able to get a grant from Care First. We're now in 8 branches. And I am really excited to say that some of you all are going to get to be part of this program as well. What I find so exciting about working with Baltimore Core and AmeriCorps is just a genuine, deep commitment to service and to health. Just like Tamara said, Baltimore is a health town, right? This is a public health town. And you all are going to get to be the front lines of that work. That is an amazing responsibility. That is an amazing opportunity. And it is truly, truly, truly an honor to get to stand in front of you and just say to you, thank you. Because what you guys are going to get to do is extraordinary. Getting to actually impact people's lives on the ground, whether it's in a hospital or a library, whatever the setting may be, that's the work. That's what we all are so committed to. You know, the governor talks about leaving no one left behind, no one behind, right? That is what you all are going to get to do, is make sure no Baltimorean gets left behind from a health perspective. So I want to close by just, again, thanking Baltimore Core. I want to say this about Baltimore Core. Fagan Harris, who is now with that other guy, Wes Moore, he's his chief of staff. He's doing great work in Annapolis. But the folks that are now the executive directors, Sarah and Tamara, are absolutely extraordinary, are visionaries, are incredibly thoughtful, forward-thinking leaders. And that you are going to get to work with them is a great, great, great privilege. And so I want to thank Baltimore Core, and I want to end by just thanking you all for signing up, for saying yes, and for being willing to take our city, Baltimore, forward. Appreciate you.
Okay. So next up, you guys are going to hear from a current cohort member. She was in our inaugural cohort, and her name is Mariama Djala. So come on, Mariama.
Hello, everyone. Everyone hear me? Okay. So, like they said, I first of all want to thank every single person here, especially AmeriCorps for giving us this opportunity, the wonderful, exceptional staff at Baltimore Core. And before I start, I have to give a special shout out to my project manager, Ogei, who is she is the absolute best, and she has made this opportunity just so worthwhile for me. So I want to just start by sharing a little bit of my story. And one of the reasons why I decided to sign up for this, because I actually have a science background, was a direct result of the squeegee kid incident. So I kept on seeing that on the news, and I spoke to people about it. And to me, it was weird, because I'm an immigrant. I come from Guinea, it's in West Africa. And I was just like, this is the greatest country. Like, why do people not have access to these opportunities? Like, I came here, I went to school, like, I just feel like it's there. So what's, like, there's no difference. So why can't other people get it? And as I just saw some of like the attitudes towards it, where people were just being like really mean, and I was like, okay, well, let me think about this. And then this opportunity came about. So I was like, okay, you've talked about this, you know, you want to do something, this is your opportunity. As I signed up, and now I'm currently on the CNA track at St. Agnes, seeing just a lot of the issues people deal with, it's very personal. It's not something that people are like, oh yes, I have this addiction. Oh yes, I have this problem. Like, it's not something that people say with pride. So when things are rooted in privacy, it's a lot of times rooted in shame. So it's really, really hard for people to step forward and ask for help. And as a reformed judgmental person, I'll be honest, I think one of the biggest takeaways I've taken from this is if you cannot make someone's day better, do not make it worse. Okay? If the best thing you can do is be quiet, please do that. Okay? People are going through things that if you are not going through, it's hard to fathom because you're like, oh, well, I have this. Why can't they get it? That may be true, but that is in no way, shape, or form your business or your place. You do not know how they got there. And I promise you, it was not a choice. They did not just wake up and say, I am going to make these bad choices. Something happened. And that is the essence of what I feel Baltimore Core embodies. They try to work with you every single step of the way. So as you are all new cohort members, I want to leave you with 3 pieces of advice. First of all, there is a system in place to help you. Use it. Communicate with your project managers, with your cohort. No one knows what you're going through except the other people going through it. Talk to every single person as you can. Use this for every single thing you can get out of it. Network. Make sure every single person that needs to know your name knows your name. Make sure any class available, you can take it. Ask for more classes. Whatever you need, they are here to help. So do not feel shy or uncomfortable or feel like you're asking too much. You're probably not asking for enough. Ask for more. Secondly, this is a service learning opportunity and a commitment. It is not going to be easy. It is not going to be, how do I say? It's not going to always be fun. But like she said, keep your why in mind. There's a reason why you decided you wanted to do this. There's a reason why you applied. There's a reason why you filled out the application and did all of this. So keep that in mind and keep the long goal in mind when things get tough. And lastly, I just want to leave you with, you are living inside of an answered prayer. So to me, that means that this is something I hope for. I am using this as a way to get my MPH and hopefully to work internationally. Okay? So keep that in mind. Whatever you prayed for to get here, whatever you hope for and yearned for, keep that in mind when it gets annoying and when it gets hard. Okay? All right. And congratulations to everyone, and thank you guys so much for doing that.
Awesome. Thank you. And thinking back between what Zeke has shared and what Mariama has just shared, understanding your why, I think we kind of really all got that now. But especially that you're not in this alone, but you are part of a bigger work of change that has been happening before you. There's change that each and every one of you have already been doing. And we talked a lot about that in the last 2 weeks. And so this is really just a bubble up effect that is not just going to affect change for your life, but for the folks that you are going to be working with and alongside. So in thinking about that, even once we're done with the swearing in portion, really, I would encourage you to really work your way around the room and to really challenge you to just meet two people that you have not talked to in the last 2 weeks, whether it be another cohort member or some other faces in the room, because we are, like I said, in a particular opportunity where we are surrounded by change makers at different levels in which we've been doing this work. So to represent some of the folks that you will be working alongside with, I would like to call up a partner of ours from Holistic Health, Counseling, and Coaching to be able to talk about the experience from a partner level and what it's like to venture down this work. So thank you so much, Raven Spady. Come on up.
Hello. So I'm Raven. So I'm Raven. I'm also a licensed clinical social worker. So one of the things that I'm passionate about in my niche is really teaching up and coming mental health workers. And I've always worked well with younger adults. So when my partner came to me about this opportunity, I'm like, yeah, sure. I'm the right person for it. So what I would say is that my experience with AmeriCorps Baltimore Corps has been really positive. The young people that we have been able to work with have been able to come aboard. We've been able to talk about mental wellness. What does wellness look like to you? What does wellness look like to the community? It's one thing to work with an individual, but when you work with the community, you can have a broader outreach. So one of the things when they come in, we teach them how to meet people where they are, how to do like a needs assessment, how to develop groups. They've been very instrumental in coming up with group topics, doing our newsletter. One of the young ladies that we work with started the newsletter. She's no longer with us, but she gave us the blueprint and we run with it every month. So one of the things that I'm ready for the next cohort. And yeah, Holistic Health.
Thank you, Raven. And that's exciting that someone was able to start something that continues on at the organizations. And there are quite a few stories of the work in which we've worked with fellows and AmeriCorps members of the past, and a lot of the work that they started continues on at the organization. And so I'm excited to hear about the work that you'll continue and will continue on past your year or years of service. Now we're going to call up one of your near and dear friends in this current cohort, Nigel Jackson.
Good afternoon, everybody. I'm Nigel Jackson. It's a wonderful panel to be among, to be in this room and have so many influential people. This is amazing. Man, this is an amazing place for me to be right now. And it breaks my heart sometimes when I get to talking like this, because just 133 days ago, I was in federal prison. And to be out here today, it's really amazing, man. What Baltimore has to offer. I'm from Columbus, Ohio. And me coming to Baltimore, the main reason I came to Baltimore is because I caught my federal case here in Baltimore. A guy from Baltimore came to my home in Columbus, Ohio, and was up under a federal investigation. And he left my home, and the police came back, the feds came back and arrested me. It was a drug deal, flat out. But today, and I just want to say thank you all for having me be a part of something so amazing. A lot of people in Baltimore, and the reason I came to Baltimore after sitting in a federal detention center and seeing there was a young girl about 2018 named Tawila. She had got shot, and her sister had got shot a year prior to that. She was 7 years old. I'm sure some of you might remember the case. And that just made me want to change my life, and being inside of the detention center and seeing so many young men come in there with a little bit of drugs and so much time facing it over their head, that made me, because I looked at them young guys in there if they were my own sons. I got a son right now because of my damaging consequences and my irrational acts, that when I was in Baltimore, he caught a murder case in Ohio. He's serving 18 years in the state prison. So I do this thing to better myself, not only because I see so many wonderful people in here in the city of Baltimore, period. But I want to change my life and give back instead of taking out of the streets around America as I have in the past, whether it be, doing whatever I was doing, living a anti-pro-social lifestyle. I'm a changed man, and I'm grateful to be here. Thank you. That's just the introduction. You got your turn. Let me get All right. Like I said, good morning. I'm Nigel Jackson, and welcome to the AmeriCorps Baltimore Corps swearing in ceremonial inauguration. Give yourselves a round of applause. Like I said, today is a monumental day. Not only is it June 27, 2023, it is also my 133rd day out of federal prison. Every day I keep track of the days that I'm free as a reminder, just as I would count the days to my release. I'm counting these days to live a pro-social lifestyle in society now. I'm changing my life to be a better person, a better parent, a better son for my mother and my father. One thing that importance that it changed my life as a person is because all you people in this room right here, all the cohorts and the ex-cohorts and the people who put the money up, I'm confidently able to say that everybody in here is a changed person, because if you weren't willing to change, you wouldn't even be in this room. And Kobe Bryant said, I read in an article one time, that he said the path to success is an isolated journey. Sometimes to achieve that true greatness, we will have to turn people away who are not favorable to our success, because those same people will have us doubting ourselves. And I don't doubt for 1 minute that there's anybody in this room that's going to be a failure, because we realize when it comes to helping others, that's what we're here for. That is our purpose. God has put us here in this position to change the lives of others. What we're doing takes a lot of courage, knowledge, wisdom, and understanding. With that being said, please keep in mind of the wonderful people who have made this happen here in Baltimore Corps and AmeriCorps. And remember to stick to the script. Don't flip. That's all I got to say.
On a sticky note in my house somewhere, stick to the script. Don't flip. I like it. Before I pass it over to our last speaker, who is also the director of public health at AmeriCorps, will officially be swearing everyone in. I did want to acknowledge a few individuals in the room, besides your wonderful selves, you guys entering into this opportunity, but also to that larger network and to the people who work every day to ensure that this opportunity and other opportunities like it continue to exist, continue to emerge, and that they really had their place in being able to make our city what we want it to be. And so to those individuals in the room, I'll ask you to either stand or wave, whatever you are comfortable with right now. But can every Baltimore Corps staff member, AKA Changemaker, please stand and wave in the room? I also want to acknowledge Dr. Leticia Tisraza again. Thank you so much for coming. We are so excited to have you here and to be able to continue this work with you in this great city in more monumental and impactful ways. Also, Erin Dolan, the Director of the Service Year Option at the Governor's Office.
We are very excited for the work that the governor's office is doing and its commitment to service as a career within Maryland and the opportunities that abound there. Also want to say a special hello to Ilana B. Jones, Baltimore City Regional Director, Office of Senator Chris Van Hollen. Zeke's counterpart in the work of the Healing City Initiative throughout Baltimore City, Kim LeGray. Rashida Harrell Brockington, Assistant Director of Healing City. And then also want to give a special thank you and acknowledgement to the wider network of Baltimore Core. So remember I said that Baltimore Core is not just one thing, and it's not going to occupy just one lane. We're kind of nosy, and we like to be everywhere, up in everybody's business, doing the work alongside with them. And so as part of a larger initiative, we have an opportunity called City Core, in which we work with local leaders in other cities throughout the United States. And so I want to celebrate those individuals that are in the room. Yamini Bhatt of Birmingham Core, who just celebrated their 1 year. Yamini Bhatt is the Executive Director of Birmingham Core, which is a sister city to Baltimore Core in Birmingham, Alabama. And they just celebrated their 1 year of establishment and hard work that they've been doing. As well as the support that she has from our City Core National Advisory Board members, Alex Hughes and Richard Brown. So, it's not just you, but you're in a room with a whole lot of people doing a whole lot of things, and we're really all here to support each other in taking our best next step forward as we do that for ourselves, for our community, and for the city at large. But then most importantly, for the country. And so with that, I will introduce AJ Perlman, the Director of Public Health AmeriCorps, who will talk to us a little bit more about that and officially swear us in.
The hardest part about going last is you've heard all of these amazing stories already, so wish me luck, please. Good afternoon, everyone. I'm AJ Perlman. I'm the Director of Public Health AmeriCorps. Thanks so much for the warm welcome here, and I really love the atmosphere in the room and the positivity that I am feeling from all of you. So thank you for that. And also just allow me to bring greetings from our CEO, AmeriCorps CEO, Michael Smith, who has been with us in the past, but is off on travel today. Let me do a quick round of thanks. I know there's been a lot of thanking already, but Tamara, for your leadership of Baltimore Core, thank you. We are honored to work alongside you and the entire Baltimore Core team in support of this innovative service learning opportunity that we believe is training the next generation of public health leaders here in Baltimore. Councilman Cohen, really appreciate your dedication to young people here in Baltimore and for your efforts to make Baltimore a healthier and more equitable city. I know we've called out Deputy Mayor DeRosa quite a bit already, but thank you. And I just wanted to point out to this room, Deputy Mayor DeRosa is the essence of a public health leader. So you have all experienced her work in action and really look forward to seeing what you all do in the future as well. Raven Spady, thank you for serving as a host site for Public Health AmeriCorps members and for your mentorship and support of this next generation. Also, thank you to Erin Dolan, who is my former coworker that Tamara called out as well as to Alana B. Jones from the Senator's office for joining us today. And finally, to Mariama, to Nigel, and to all of you, all of our new Public Health AmeriCorps members, thank you for showing up, for standing up, and for choosing to do the hard work of serving your community. So Tamara talked a little bit about a blast from the past. I'm going to take you on a little bit of my journey. My own journey into the field of public health was not a traditional path. When President Obama signed the Affordable Care Act, or you all may know it as Obamacare, back in 2010, giving millions of Americans access to quality health care for the first time for themselves and their families, I jumped at the chance to play a part. But I wasn't a public health professional. I was just a baby lawyer who wanted to get involved and maybe not be a lawyer anymore. So I joined the federal government to help with outreach and public education, talking to people about Obamacare and how it could really impact their lives. The outreach plan included a variety of stakeholders. We talked to healthcare providers. We talked to community-based organizations. We talked to real people who would benefit from the law. But the outreach plan didn't explicitly include LGBTQI individuals and communities. And as a queer person with a spouse, with hopes for a family, and with transgender friends, and a place in the room where decisions were being made, I asked if they could be. So before the Affordable Care Act, you could be denied insurance because of a pre-existing condition. And insurance companies considered being transgender a pre-existing condition. So we talked with trans communities about getting insurance through the healthcare marketplace. And for the first time, we were able to say, you are not a pre-existing condition. And at the time, if my spouse had gotten sick, I had no right to visit her in the hospital. I wouldn't have had any right to make emergency medical decisions if she had gotten ill as well. So through the work of many openly LGBTQI people in the federal government and at HHS, we made hospital visitation a reality for all types of families years before the Supreme Court legalized marriage. And we talked with LGBTQI groups, communities, and individuals about their rights, our rights, and their healthcare needs. Being in the room matters. And it made me realize what else was possible if we just kept making the room bigger at the local, state, and federal level. And that's what Public Health AmeriCorps sets out to do. We want to make the room bigger. We want to get more people in the room and increase representation to drive more equitable impact. So we not only need more people, we need a new generation of leaders, including all of you, to reach all corners of our communities. As you set out on this program, I want you to know that you have the chance to be a part of the systems that influence your health and the health of your communities. So as our CEO, Michael Smith, says, AmeriCorps is not a pit stop, it's a pathway. Our goal at Public Health AmeriCorps is to create pathways for people with different lived experiences to be in the room, so that people from diverse backgrounds and different levels of education can have a pathway to good jobs, so that we can build a public health workforce that can meet the demands of communities all across the country, and so that people who are providing much needed care represent the communities they are serving. So I am incredibly excited to be a part of this swearing-in ceremony today, because you all represent the future of the field of public health, and it's an honor to be just a tiny part of your journey towards leadership and service here in Baltimore. So thank you for everything you are doing. We're going to do a little bit of transition because I want all of you to join me up here before we take the AmeriCorps pledge.
Come on up. Thank you.
Sorry about that.
We're just going to do a really quick picture because Dr. B has to leave, and then the swearing in, and then we're everyone who should be in the picture, come in. Staff,
So many people. Okay, everybody. Look at us over here. 1, 2, 3. America! Yay, love that. That was good. It's a big group. I got everyone in. Let's do one more just for safety. Okay, 1, 2, 3. America! All right, that was beautiful. What's good? Okay.
The important part is you're gonna repeat after me, so I'm gonna do this line by line. Let's hope I don't mess it up. All right, ready? Okay, repeat after me. I will get things done for America.
I will get things done for America.
To make our people safer, smarter, and healthier.
To make our people safer, smarter, and healthier.
I will bring Americans together to strengthen our communities.
I will bring Americans together to strengthen our communities.
Faced with apathy, I will take action.
Faced with apathy, I will take action.
Faced with conflict, I will seek common ground.
Faced with conflict, I will seek common ground.
Faced with adversity, I will persevere.
Faced with adversity, I will persevere.
I will carry this commitment with me this year and beyond.
I will carry this commitment with me this year and beyond.
I am an AmeriCorps member and I will get things done.
I am an AmeriCorps member and I will get things done.
I don't want to block any of you. We're going back down. All right, do it again. Yeah. All right, I just feel like a celebratory time, like, yes! 1, 2, 3.
Yeah, love that.
Don't forget to meet
Hi, I'm Paula. Nice to meet you. What's your name? Sid. Sid? Yeah. All right. Thanks for the good pictures. Yeah.
I just wanted to know if there's going to be any more activities that you want to be streaming or doing.
Yeah. Karen.